the leader in HD. This is 12 News Weekend Today.
How many of these are in your refrigerator? The superfoods that are revolutionizing the way we eat and how they make for a healthy, trimming diet. It tops nearly everyone's New Year's resolution, lose weight. Dr. Matt French, with a diet program he believes is a miracle diet, really, is here to talk to us. And Matt, I'm going to talk to you about this, and one of the critics out there about this, but you're seeing major results, and we're seeing this around the country. These clinics pop up with this key component to the diet. Tell us about it.
Well, it involves a combination of a low-calorie diet with a pregnancy hormone called HCG, a very low dose. And there is a magic combination when you combine those two that it causes a rapid fat loss rather than just moving somebody into starvation, which is what a low-calorie diet alone would do. So we're seeing the body rapidly give up its fat for energy, and the metabolism is not dropping off like you would see in somebody that's going through a severe caloric restriction.
So you have your clinic, and you've been doing this for about 1.5 years with patients. This is called the HCG Diet, right?
Correct. Yeah. And
as we see some of the results here, tell us, this isn't an injection. How often do people take it?
Fortunately, they're the tiniest little needles, they're little insulin syringes, so really there's minimal pain, if any at all. The injection is done daily for a maximum of 40 days. After that, we transition people to a lifestyle program because most importantly, we want to make sure people maintain that weight loss. So I have a physician that heads up the medical end, as far as dealing with the prescription and the hormone, and then I head up the lifestyle end to make sure people are able to maintain those results.
So do they need to continue taking the injection long term, or can they
Absolutely
wean themselves
not.
off it?
Absolutely not.
So how many months or weeks would they take it?
Maximum of 40 days in a cycle. Now, if somebody needs to lose more weight, we can take a month off and then go back and repeat. I've had patients lose 120, 150 pounds by doing 4 or 5 rounds of this.
Any side effects?
Most of the side effects are pleasant, believe it or not. There seems to be some hormone balancing effects in many people. As far as negative side effects, very, very few.
Okay. I know there was a report on this recently. A chief endocrinologist at the University of Utah said this is a scam. He said if people are losing their appetite, it has just a placebo effect.
And many in medicine are opposed to this. It has not had any major studies done on it. However, the studies that have been done have showed quite the contrary. And in particular, there's a major difference between what the hormone does as far as fat loss. And in our experience, we certainly see an effect with appetite as well. And to prove that with a few people, I've had them stop the shot for a few days, and their appetite shoots up.
Really?
Yeah.
Okay. Again, it's called the HCG Diet, and it involves these low doses of a pregnancy hormone. I appreciate you coming in and explaining some of this.
Absolutely.
And we want to let you know that there are a couple of weight loss informational sessions over the next week. For more, you can call the number on your screen, or we've put a link to the doctor's website at ours. You can check it out at 12news.azcentral.com. Thank you very much for coming in, Dr.
Absolutely.
French.